Hello, everyone. This is our professionalism group presentation. The presenters are Abby, along myself, Dosia, Erica, Franklin, and Goldie. Enjoy.
So Christy is a 28-year-old Chinese-American female with a history of IV drug use, and she was found outside the halfway house and presented to the emergency department after an opioid overdose. So the patient presents with restlessness, has poor eye contact, is sweating profusely, and is in active withdrawal. The toxicology screen came back positive for opioids and marijuana. Christy has anxiety, depression, and bipolar disorder that's related to substance use for the past 7 years. Christy grew up in an upper middle class, came from a good childhood, and she currently has she has 4-year-old twin daughters that are currently with CPS. In regards to her home situation, Christy is currently living in a halfway house with no occupation, income, or health insurance.
The threads of focus that we chose, thread number 1 is going to be professionalism in nursing roles. For thread number 2 is going to be social determinants of health. And thread number 3 is going to be the healthcare financing.
Professionalism in nursing roles, thread number 1. As nurses and current and future nurses, we're trained and required to use professional practice modules as a guide in nursing practice. By doing so, we're able to effectively work together to achieve the best possible outcomes. As nurses, we care, we influence, we empower, we achieve, and we excel. In regards to our case study patient, Miss Christie, our duty to her would be to challenge our biases, choosing to see her as a person suffering from a disease, in this case, substance abuse, and not as a drug addict. It is also our duty to treat her with sensitivity, compassion, and clinical excellence. For this to happen, the nurse has to provide a judgment-free environment, ask open-ended questions, listen actively, and acknowledge her pain, as this would help build an atmosphere of trust and also facilitate an effective treatment plan. During treatment, it's also important to know that overcoming addiction is not achieved overnight. So patients require evidence-based practice to mitigate withdrawal symptoms, reduce pain, and prevent infection.
So some of the challenges, risks, and concerns of the nurse caring for a patient with opioid addiction. First, recognizing and treating withdrawal. Patients describe withdrawal as the worst flu I've ever had. They'll have pain in their stomachs, bones, muscle. They'll be sweating or shivering. They might have cramps, diarrhea, anxiety. The thing is that many substance users lack resources to healthcare. So by the time they reach an ER, their health is much worse. But still, many patients will leave before treatment is completed because they're denied withdrawal medication. Another big issue is in healthcare is that we worry about managing pain in the presence of addiction. So a person who has an addiction who also suffers an injury might require more opioids to numb actual pain because they've built tolerance. But those people are often labeled as drug seekers and therefore denied treatment for their pain. Also, nurses are often undertrained in addiction, which perpetuates negative attitudes and results in worse outcomes. So professional responses or next step for the nurse would be nurses should be knowledgeable about addiction, pain management, detox processes, and opioid withdrawal. We should have a thorough knowledge of assessment, so everything from evaluating track marks for infections, nutrition and hydration status, mental health, comorbidities, and withdrawal symptoms. We should provide meds and treatment comfort. So opioid agonists such as methadone or Suboxone will relieve withdrawal symptoms and help the detox process. IV fluids will prevent dehydration. Acetaminophen and NSAIDs could provide pain relief, and antidiarrheal meds can be given as needed.
Social determinants of health. Our topic, according to the World Health Organization, identifies social determinants of health to be the conditions in which people are born, work, and live part of. And these conditions have a wider set of forces that shape the experiences of daily life. These forces include economic policies, social norms, and political systems. Furthermore, the Centers for Disease Control, CDC, and Preventative Healthy People 2030 initiative identifies economic stability as one of the 5 areas of social determinants of health. Just as economic stability can confer health benefits, economic instability can create health risks and challenges. And this is definitely something that applies to Christy. The challenges and risks that include are lack of health insurance, unstable housing and unemployment, factors that can put her at risk for further drug use, lack of social support, a factor that may be concerning regarding her care at the hospital and when she leaves, comorbidity, a risk for developing other major diseases, and lastly, mental health, a factor that can be concerning regarding her mental status over her emotional, behavioral, and cognitive problems, as well as her coping skills.
So in regards to professional response or next steps for the nurse, they're going to want to engage with the patient to identify social issues. So as Anderman recognizes in her 2016 article about addressing the social determinants of health and clinical practice, in order for healthcare workers to progress health equity and provide appropriate care that is patient-centered, there is a need for healthcare workers to take time during health visits to ask patients about the social challenges that they face. Therefore, one way that the nurse can respond is by learning more about Christy's social, economic, and living situation by engaging with her in a way that is sensitive. This will offer Christy an opportunity to open up about any challenges or worries that she has about her care or life circumstances that are most important to her right now. Another important next step will be for the nurse to refer the patient to a case manager and social worker who can work closely with Christy in the community and help her gain access to appropriate social and health services to address her social, economic, and housing needs.
Our third and final thread is concerning healthcare financing. This concerns our patient Christy because it applies to all adults. Insurance coverage is associated with decreased mortality. For example, after Medicaid expansion from the Affordable Care Act, 6 million new young adults were newly insured, and the Medicaid expansion was associated with a 6.1% reduced mortality in all causes. Expanding insurance coverage can also reduce the healthcare costs related to treating substance use disorders. We know that $24 billion were spent in 2009 just in related to treatment for SUDs. But if we further invest in things like methadone treatment, we can save money by saving ourselves $4 to $5 for every $1 invested.
Several people in the United States, like Christy, would benefit from professional help and service for their substance use disorder. Most funds are available for patient support with their rehab right after they get discharged from the hospital. State-funded substance use and detox treatment programs are covered by Medicaid, the Affordable Care Act, as well as few others listed here. Some of us may be familiar with Maryland Governor Larry Hogan signed executive order in 2017 declaring a state of emergency in response to substance use crisis. And $50 million was implemented toward purpose like to improve treatment and recovery, to provide clinical education, to have prescription drug monitoring program, and to increase access to naloxone at no cost.
So some of the challenges and concerns about healthcare financing include some factors with the patient. For example, social determinants of health, as we previously mentioned, impact a lot on her accessibility to getting insured. For example, stable housing and food insecurity may distract her from seeking ways to get insured. Furthermore, financial literacy might be a barrier to understanding various social, insurance policies or terms related to coverage.
So what's our role as a nurse to help Christy? Simply inform her about the state and federal programs that are available at no cost. Also reminded her her patient rights. It is very important that Christy is aware that she is protected by the law, which is the Mental Health and Addiction Equity Act. We can also have her call to Maryland Crisis Connect hotline service at 211, so she can get the service and program that she desperately need.
So for the SBAR, hi, this is Nurse Tina from the ER. I'm calling MedSurg about Christy, a 28-year-old female patient in active withdrawal from opioids and IV drug use. She's seeking treatment for opioid withdrawal and addiction recovery. The patient has a temperature of 99.9, a heart rate of 108, blood pressure of 118/76, a respiratory rate of 20. She is anxious. She has cramps. She's sweating profusely. The tox screen is positive for fentanyl, heroin, and marijuana. I've assessed her for addiction using CAGE, and I used COWS, where she has 7 of 11 symptoms. I recommend that this patient gets medically monitored detox and management of withdrawal symptoms. She should see a social worker to adjust social determinants of health and link her up with health insurance. Discharge planning should evaluate the need for inpatient treatment and should connect this patient to follow-up addiction treatment and social services. We should also educate the patient about harm reduction and the risks of relapse and overdose after discharge so that she can practice the safest choices.
Thank you so much for tuning in. Take care.